So as for from today, we're going to discuss on the yes. So we're going to discuss on the physiology of lactation. Okay. So, oops. Can you guys see my slide? Patrick, can you see my slide right now? Okay, so let's continue on the physiology of the lactation. So we know that prior to pregnancy, okay, so there are the regulations of the hormone. All right, these hormones, which are the two major hormones, which are progesterone and also estrogen, are actually helping that females or that pregnant lady to develop the necessary or to develop the accessory organ so that it can be prepared whenever the labor occur. Okay, so one of it is the preparations for the lactation process. So meaning that once the baby has been born to the world, what are the things that trigger the milk productions? Okay, before that, during pregnancy, the body itself has already prepared for the lactations. And then once the baby has been born to the world, okay, so the ejections of the milk occur. All right, so all of that we call it as the lactation process. Okay, so in the lactation process is include how the milk has been produced, okay, and then how it has been secreted into the mammary ductal, and then how it's being ejected from the breast out into the baby's mouth. All right. So before that, we need to discuss on the development of the female mammary gland during the pregnancy, okay, as the preparations for the laboring process. And then what are the regulations? So the regulation is actually depending on the hormonal regulations. Even though there are mechanical stimulation that trigger the milk to be produced and to be secreted out of the breast, they are actually the hormone under the hormonal influence. Okay, and what are the things that initiate the milk production and maintain the milk productions until 2 years of time? Sometimes the female can give or can breastfeed, can nursing the baby until 3 years of time. All right. So, but some of the women just experience only 6 months. But some of the women, they might lack of milk. Okay, so they are not able to give an exclusive breastfeeding for the baby. So what is actually happening? What are the things that trigger and that regulates the maintenance of the lactation process, and then the ejections of the milk? Okay, in the let's take a look at the term itself. So we have the mammogenesis. So mammogenesis is actually the development of the breast into the functional state. So meaning that this mammogenesis is actually occurring since the girl is undergo puberty. All right, so the breast is start developing, because please remember back that I mentioned to you in the menstruation is actually the last signs of the puberty. So the first signs of the puberty is actually mammogenesis. So once the girl starts reaching the puberty, it's not necessarily accompanied by the menstruations. So it is the mammogenesis, the development of the breast will start occur. And then lactogenesis, all right. So the synthesis and the secretions of the milk from the breast alveoli, meaning that it just synthesize and secrete the milk is just inside the breast. It's not has been secreted out of the breast, right? And then and then the galactokinesis. So we take a look at the kinesis, so we know it's the process, right? The action. So the ejections of the milk, all right? And then the galactopoiesis, which is the maintenance, and then involution. So involution is basically in animals we say weaning, all right? Basically we use the word weaning, or sometimes stop from breastfeeding. So it's actually a regression and atrophy post-lactational process. So meaning that when that females are no longer breastfeeding, so involutions is actually happening. Okay, look at the developments of the mammary gland. Okay, there are various stages. This is occurring during the birth, the baby at birth. Okay, so during birth we can see that the breast itself is remain inactive. When they reach to puberty, you can see that there are branches, the epithelial ductal cells start expand. Alright, and then they start a mammary fat pad, they start develop. Okay, you can see this. Okay, so they are start developing, and the mammary gland, the epithelial cells start differentiate into a various type of cells. There are alveolar cells, there are epithelial cells, there are luminal cells. Alright, there are epithelial body cells. Alright, so they start preparing until when they reach a virgin. You can see that the the epithelial ductal cell start undergo branching. Alright, and then during the lactational, you can see that the alveolar cell is actually start developing. Alright, so the lactational is actually occur during pregnancy. Alright, even though that the lady is not gonna give or not gonna produce a milk. Alright, but the alveolar is actually preparing to secrete the milk. Alright, so the alveoli of the mammary gland is actually just like the alveoli of the lungs. Alright, what's make it different is that this alveoli is actually can produce a milk and store a milk in it. In lungs, this alveoli is actually filtering the oxygens and also carbon dioxide. So at the outer layer of the alveoli is actually myoepithelial cells. So it's just similar with the lung. In the alveoli there is a epithelial cells which help to secrete or contract to secrete the milk into the epithelial ductal cells later on. Alright, so during involution we will see that the epithelial cells start decreasing and will be flat back into its original state. Okay, in the immature females, alright, so prior to the puberty, you can see that they are immature with a few network of ductal. Okay, so ductal is the lactiferous duct and also the rudimentary nipples, and there are no difference between the male and female. That's why to take a look at the baby boy, it's not baby boy, a kids, a boy and the girls, their breast is actually look just like the same. Okay, their nipples, the size of the nipples, the size of the breast itself is just the same because the mammary gland at that time is not yet developed. Okay, this is during the childhood. Okay, once that females reaching the puberty, okay, so we call it as the teloche. Alright, the mammary gland start developing. So this process is actually happening before menarche. So before menarche means before menstruation. So that's why I said that the menstruation is actually the final stage of the puberty. The early stage is the development of the breast itself. Alright, and then you can see that the hemisphere projections of the breast will start develop. So the breast will start look like a bulging shape. It's just a small bulging shape. Alright, and then what is actually happening, what causes it form the hemisphere projection is because of the growth of the ductal system, and also the glandular tissue will start develop, even though there are no developments of the alveolar cells and so forth. Alright, and then there are the fat depositions and also the connective tissue development. Alright, so this is the adult mammary gland. If you take a look at this graphic on the sagittal plane cross section, you will see that is a fat pad, the yellow color over here, right? So that make the breast enlarge, and this cloud-like structure is the alveoli, alright, and this is the mammary duct, alright, and then they merge together to form the lactiferous duct, lactiferous sinus, and down below here is the lactiferous duct. Okay, so what is the functions of the mammary gland? Of course, the mammary gland, the breast, all right, of a female is functions for the nursing process. So the nursing process, we have the for the lactation process, we have the lactogenesis, the synthesis of the milk, all right, and then followed by the secretion of the milk and also the storage of the milk. Even though the milk has been synthesized, has been secreted out into this what do we call the mammary duct over here, it's been collected in the mammary duct and so forth. All right, it has not yet been secreted out of the breast, so its functions to storage the milk, okay, and then later to eject the milk out. Okay, let's take a look during the pregnancy. What's actually happening to the breast? All right, in the first half of the pregnancy, meaning that starting from the first month up to the 4.5 months, okay, the breast will start develop, will start enlarge. So what are the things that trigger the enlargement of the breast? What are the things that trigger the preparations of the breast for the lactations during this time? That we know during the pregnancy, the female will have a lot of estrogen and progesterone, by which the first trimester, this progesterone and estrogen being supplied by the corpus luteum, and later it's been taken place by the placenta. And later, the concentrations of the estrogen and progesterone is not only helping the development or preparing the uterine to give a nutrient, to embed the babies and so forth, it actually helped in the lactogenesis process. So it caused the enlargement of the breast. And this progesterone and estrogen help to differentiate the alveolar cells. Okay, so but still there is no productions of milk. So what are the things that stop the productions of the milk when the alveoli is being developed? Must be that inhibit the secretions of the milk during pregnancy. Okay, so this is just the alveolar lumen. You can see this is the alveolar cells, all right, with the nucleus. So when these alveoli start producing a milk, okay, in the process of lactogenesis, it will secrete the milk into the alveolar lumen. Okay, the milk will be collected here. Instead of just synthesizing, secreting, it will also storage the milk before ejaculation process occur. So this is the alveoli. Okay, just look like the alveoli of the lung. You can see there are myo-epithelial cells. So myo means muscles. So the epithelial cells together with the myo-epithelial cells. So these cells will trigger the contractions of the breast so that it can eject milk into the lactiferous duct, down to the lactiferous sinus, to the duct, and then secreted out as the ejection. Okay, in the second half of pregnancy, by which the end of the gestation, meaning that towards the 5 months till the end of the pregnancy, you can see that there will further enlargement of the glandular tissue. So during this time, we can say that the lactation process is actually going to be ready. Alright, so what are the things that regulate the lactational process? Is actually the estrogen and progesterone, of course, and this is happen during the pregnancy. Starting from the first periods of the pregnancy up to the 9 months of the pregnancy, the estrogen and progesterone is actually helping the lactational process, preparing for the lactation process. And also, we have a prolactin and also the placenta hormone. So what are the prolactin and placenta hormone do? Okay, before that, let's take a look at the estrogen first. So estrogen, it will help in the growth and differentiate the ductal tissue. Alright, it will also cause the lipid depositions, and it also will secrete the inhibin. Alright, so we have the inhibin. Alright, high level we will the estrogen at high level will inhibit the lactation. Okay. Together with the progesterone, we see that progesterone also will promote the enlargement of the mammary gland. It will also promote the growth. The growth is from the estrogens, and differentiations of the ductal tissue is under regulations of the estrogens. But for the progesterone, it will promote the enlargement of the mammary gland. Alright, so alveogenesis also occurs during this time, by which develop the growth of the glandular gland, and similar, it will inhibit the lactation process. So meaning that whenever you have a high level of progesterone and high level of estrogen, this high level of estrogen and progesterone will inhibit lactation process. Okay, so these two hormones is just actually preparing for the lactation process, and they are inhibiting the lactation. Okay, in the prolactin, when you look at its name itself, pro means towards, lactins means lactation, so towards the lactation. So prolactin is looking for the lactation. So it is necessary for the milk secretions and the primary lactogenic hormone. So this would not come out in MCQ lah, because it is obviously will be true. If the question coming out like what is the hormone that aids or crucial or the primary for the lactation process, and there is prolactin, inhibin, estrogen, of course we will answer it as the prolactin. Okay, but you have to bear in mind that prolactin is very, very crucial. And please remember that what are the hormones that inhibit the lactation process? There are two hormones, which are the estrogen and also progesterone, which is in inversely to the prolactin. Okay, now we have this prolactin is actually induced or promotes the growth of the mammary gland during the pregnancy because the prolactin also available during pregnancy. Alright, but since we have estrogen, progesterone, prolactin during that time, so estrogens and progesterone will inhibit the actions of the prolactin. So there is the prolactin hormones during pregnancy, but the level cannot compete with the level of the estrogens and progesterone. So the progesterone and estrogens during that time will inhibit the actions of the prolactin. See that this is a stage of the development. This is the rudimentary of the mammary gland, and then the lactic ducts start developing and start branching out. Okay, and then the alveoli will start produce, which is this is immature alveoli in a non-pregnant lady. Alright, once that lady, alright, so there are a lot of progesterone and estrogen. This progesterone will regulate the growth and also the proliferations of the alveoli and all those, start branching them out. Okay, and then when there is high levels, when there is when the labor processes start occurring, so the estrogen and progesterone level will start decrease. Okay, there are high level of the prolactin, and okay, when a woman are going to give birth, okay, there are one hormone that trigger the labor process, which is known as the oxytocin. So oxytocin is actually the crucial hormone that promotes the lactation process instead of the prolactin. So we're going to take a look at this later. Okay, so okay. How can I explain to you? Okay, take a look at the third image over here. If you can see my mouse over here, my cursor. When the pregnant lady, okay, during the pregnancy, okay, the alveoli will start develop. Okay, during the pregnancy, you will see that we have that pregnant lady will have high amount of progesterone and also high level of estrogen. Similar, they will have a prolactin, but prolactin is very minute together with HPL. Estrogen and progesterone is very, very high is comparing to the prolactin. Because of the high level of the progesterone and estradiol or estrogen, these two hormones is actually will inhibit the actions of the prolactin to induce the lactation process. Okay, it will inhibit the activity of the prolactin. But prior to the labor process, okay, when the females are going to giving birth, all right, so the oxytocin level which help the laboring process actually is getting high. So prolactin is there and the oxytocin is high. So prolactin and oxytocin going to take place of the progesterone and estradiol. And estrogen. Okay, sometimes we call this the estradiol. Okay, when the estradiol is used, so there are no more things that will inhibit the actions of the prolactin and oxytocin. Therefore, prolactin and oxytocin will stimulate the lactation process. Okay, if we take a look at this, we will see that this is during birth. Alright, this is a prolactin level. The prolactin level is very, very low. Until birth, we will see that the prolactin level is high. And at birth also, you will see that the progesterone and estrogen will drop immediately. So the increased level of the prolactin will trigger the lactation process. Okay, after parturitions, I did mention this just now. After parturitions or labor process, parturition is also called as the labor process. Okay, after labor, the placenta hormone, steroid hormone will decrease. So when this placenta hormone, pregnancy hormone decrease, remember prolactin and oxytocin will increase. So oxytocin will help the myoepithelial cells to contract. So when the myoepithelial cells around the alveoli of the mammary gland is contract, so it will help the secretions of the it will help the ejection and secretions of the milk out of the breast. Okay, in the lactation process there are two actually. The first one is the secretion. The milk being produced and be secreted into the alveolar lobule. And the second one is the ejection process. So ejection process is the ejected out of the breast. Alright, in the milk secretions, the milk is actually synthesized by the alveolar epithelium. So the alveolar epithelium itself is acting like a sweat gland which produce the milk. And the milk later will be passed into the alveolar lumen in between, in the middles. So all of it will be passed there, and the milk passage, and later, once the contractions of the myoepithelial ducts occur, myoepithelial cells occur, it will push the milk into the ductal system. Okay, two phases in the milk secretions. We have, in the milk secretion itself, remember, we have two phases, which is the lactogenesis and also galactopoiesis. So lactogenesis is the initiation of milk secretions. Galactopoiesis is the maintenance of the milk secretion. So the milk secretions, it will initiate the milk secretions once that woman has given birth. Okay, but what are the things that trigger the maintenance of the milk secretions is known as the galactopoiesis. Alright, so in the mechanism of lactation, you can see that each of our cells in the body is actually receive the blood supply. So this blood supply is actually going to give up all the nutrients, enzymes, antibody, okay, all of the alveolar epithelial around the epithelial lumens will receive a blood supply. So this blood supply will give the nutrients, whatever the moms eat, okay, it will secrete all the nutrients, iron, vitamins, what else, the antibody into the milk. So for milk synthesis and transport, the hormones that control the alveolar growth and function. So the hormone itself are very crucial in promoting the lactation process. Okay, and then in the secondary tubules, okay, all from the alveolar cells, okay, it will branch out, it will not branch out, it will fuse together to form one major tubule, which is known as secondary tubule. So it will join to form the mammary duct later on, and this mammary duct will empty into the mammary ampulla. So in the mammary ampulla is actually the region by which the milk storage will occur. So before it's a bit secreted out, it will be stored in the mammary ampulla. Okay, and then into the lactiferous duct, out into the nipple. Okay, so how much volumes of the milks that a woman can produce a day? It's approximately about 1 to 3 liters of milk per day. That's why if you can see why the lactation lady or nursing lady, they need to drink a lot of water, and they will feel quite thirsty. That because they will produce back 1 to 3 liters of milk per day. So actually, the baby itself, a newborn baby, will not drink that much, but it's actually just the production or the supply of milk. So the remaining milks can be stored and be frozen for the future use. Okay, in the lactogenesis, okay, the prolactin is actually trigger the alveolar epithelial cells. So in the milk protein, you can see there are a casein and also lactalbumin. Alright, and there also are enzyme for synthesizing the milk, which is known as the lactose. Alright, synthesis of lactose, for synthesizing the lactose, and also there are triglycerides or fatty acid. Okay, in the galactopoiesis is the growth hormone, thyroxine, and also cortisol. Alright, so meaning that if that woman is having a problem that inhibit the cortisol productions, so it can inhibit the galacto or maintenance of the milk secretion, similar with the thyroxine. So, okay, let's take a look at the volume of milk. The first week of pregnancy, you can see that the milk that we produce is known as the yellow milk, slightly yellow or cream color milk is actually known as the colostrum. So colostrum is actually a very important and crucial because there are lots of antibodies to be given to the baby. Alright, so it just functions as the protections or immunity, give immunity to the babies. That's why nursing, okay, or breastfeeding is very important comparing to the formula milk. Okay, now let's take a look at the second week. The milk will start to undergo transition process, and then to the third week, the milk that's been produced is actually a matured milk. Okay, this is just an additional info you can read by yourself. Okay, so why the breast milk is so important? Number one is because of rich of protein and also immunoglobulin as the antibodies I mentioned to you earlier just now. Okay, it also have an antibody, right, to fight virus and bacteria. And it's not only good for the baby, it's also good for the mommy. So that when that mom breastfeeds to the baby, the childbirth injuries or childbirth, what do we call, the recovery from the childbirth will be very, very quick and easy. Okay, when you breastfeed, the hormone that help the breastfeeding process, lactational process, is actually oxytocin. So oxytocin, as we know, prior to parturitions or laboring process, oxytocin is actually will trigger the contractions, the uterine contractions. Do you still remember? Oxytocin will trigger the uterine contractions of the mother. Okay, but once you have given birth, all right, and you are actually nursing or breastfeed your baby, the levels of the oxytocin will keep maintained at that concentrations, at that level. So this oxytocin is actually will help the uterine to get back to its original size, because it keep pushing and contracting of the uterus. Okay, so we say that when that lady is breastfeeding, when that lady is breastfeeding the baby, so the recovery of the childbirth, recovery of the uterine will be much faster. All right. So, and last but not least, it is easily digestible. Okay. The hormonal regulations is the prolactin. Okay. The lactogenic activity is by the oxytocin. Okay. And then the parturitions will release from the inhibitions. So release from the inhibitions, meaning that the prolactin itself will be released from its inhibitions by the progesterone and also estrogen. Okay, so hormonal regulations, so usually 7 to 9 months after delivery. And instead of just of the hormonal regulations, there are mechanical forces that trigger the lactation process, which is the suckling manners of the baby. So this suckling manner will trigger the hypothalamic pituitary releasing hormone, and it will reduce the pituitary inhibiting hormone. So it will further secrete the oxytocin and also prolactin. Okay. Alright, in the suckling of the infant itself, the baby itself, it will cause milk ejection reflex. So instead of just calling it as the milk ejection reflex, we also call it as the letdown process. Alright, so milk ejection is the letdown process. Okay, so it is actually the positive feedback mechanism. Okay, look at this. We have a suckling stimulus, the major one by the baby. All of this information will be sent to the spinal cord and to the supraortic and also paraventricular nuclei. Instead of that, we have the sensory input. Okay, the sensory input will give a positive feedback, and another regulation is where the emotional input. Okay, emotional input, they have both positive and negative feedback. That's why if let's say that lady, okay, are going to breastfeed the baby, but they have like a negative emotional impulse to them, so it will inhibit the milk secretions and also milk ejection. That's why you have to think positively, okay, so that you can maintain the lactational process. Okay, so this is, okay, when we talk about how the lactational process occurs, the mechanism of the lactation, you can say that it start with this one, suckling of the baby, okay. These suckling motions will stimulate the neural receptors from the nipples, and then this impulse will be sent to the hypothalamus, and hypothalamus will start producing oxytocin. Okay, oxytocin will tell the posterior pituitary to store and release the oxytocin, which is the relay pathway. Okay, it will relay in the posterior pituitary, thus secreting the oxytocin, and oxytocin will cause the contractions of the myoepithelial basket. So myoepithelial cells will produce and eject the milk out. Okay, similar with the prolactin. From the anterior pituitary will cause a milk synthesis of the hormone. So if let's say that the lady have a high level of the dopamine will inhibit the prolactin. Okay, so who knows that one of the question might coming out like dopamine trigger the release of the prolactin. So the answer is force because dopamine will inhibit, okay, will inhibit the secretions of the prolactin. Okay, because both of it are in pregnancy. If let's say decrease in the gonadotropin releasing hormone, it will decrease in the FSH and also in the LH. Okay, that's how the lactational amenorrhea occurs. So what is lactational amenorrhea? So lactational amenorrhea is that amenorrhea is none of the absence of the menstruation. Lactational means that the absence of the menstruations during lactation process. So meaning that the breastfeeding mommy does not undergo menstruations. So why this process occur? Does this process normal or it is abnormal? So lactational amenorrhea is the temporary postnatal infertility, okay, that occurs in the woman at the amenorrheic and fully breastfeeding mummies. So sometimes a fully breastfeed mummy, they might facing the amenorrhea. We call it as the lactational amenorrhea. So this lactational amenorrhea is actually like a protective mechanism. Protective of what? Protect from the pregnancy. So usually when you are breastfeeding your baby, so meaning that your baby is around the age of 1 to 12, from 1 month up to 12 months. So if let's say you are able to conceive within that time, it's not necessary, it's not enough for that baby, and you are no longer capable to breastfeed your baby. So we call it as the protective mechanism actually that occurs. So you in the breastfeed, you might have a normal ovarian cycle, may delay for the month. So don't worry. Okay, but some people say it's actually a natural birth control mechanism. But this birth control mechanism, the lactational amenorrhea, is non-reliable at all. Okay, and then what are the things that suppress the lactational amenorrhea is actually suppress the ovulation process. So why it suppress the ovulation process? Because the productions of LH and also FSH is decreased during this time. So why? Because the GnRH also has been suppressed. Therefore, when there is no GnRH, there will be no LH and also FSH. So when no LH and FSH, there will be no maturations of the follicles, therefore no menstruation. That's what we call as the lactational amenorrhea. How the mechanisms occur. Okay, now let's take a look at we finished for the lactation topic. Let's move on the menopause. Okay, menopause will not take much, just a few. Okay, let's take a look at the menopause. Menopause is what? I bet that everybody know menopause, okay, instead of andropause. So andropause is actually happening in male, and menopause is actually happening in females or in women. So menopause is actually the period by which the woman does not or cease from the menstrual cycles. So in the menopause, we will learn about the climacteric and also menopause. What are the physiological changes that associate with the menopause? What are the symptoms, okay? And what are the drugs and treatments for the menopausal symptoms? So climacteric is actually a period in old age when reproductive system undergo changes. So we call it as the climacteric. Okay, so this climacteric is actually describing that the woman will undergo the changes in their reproductive system as they go older. So this climacteric usually accompanied by the menopause. So what do we call this process is actually happening when the level of the hormones in the female, which are the estrogen and progesterone, is actually declining. Okay. So what are the things that causes the declining levels of the estrogen and progesterone? Is actually the burnout of the ovaries. Okay, flashback on the topics that we learned in the productions or in the oogenesis process in the female's baby. So starting the second week of the pregnancy, four week of the pregnancy, the oogenesis process is actually happening in the baby in the mother's womb. Okay, during that time, as I said, the oogenesis process, the ovum itself keep replicating, doubles in numbers, and the baby that has been born to the world will have around millions of the not ovulating egg, high potentials of the ovulating eggs. Okay, but once they reach the puberty, okay, once they has been born to the world, this number will not replicating, but you will undergo decreasing. So how does the process of decreasing number of the potential ova occur? Is either via ovulations when they reach puberty, or either regressions via the atrophy process. Okay, regression process, or they will undergo the atresia. So this is the two possibilities that will occur to the ovum, which either being ovulated out as the ovulated ovum, ovulated secondary oocyte, or either it will undergo degeneration via atresia process. Okay, soon after, okay, monthly during the menstrual cycles, okay, during monthly menstruation cycles, okay, that females will not only, they will only one egg are actually will be ovulated out, but actually there are several or a few of the egg undergo maturations, but the one that being ovulated is only one. Even though when you're reaching puberty, let's say you still have around 200,000 of the potential ova, potential secondary, we call it potential ova, not of all of these 2,000 are actually going to survive until the end. Okay, during the FSH secretions in the early menstruation cycles, day one of the menstruation period, okay, when there are high level of the FSH which has been secreted out from the anterior pituitary, this FSH is actually trigger a few numbers of the ova to develop and to undergo maturations. It triggers a few follicles, ovarian follicles to develop. However, it is only one will undergo maturations into the graphene follicles, and the rest will be decreased out. That's why once you reach into 50 years of age, okay, the ovary will start burn out. There will be no numbers of the potentials of follicles remaining in the ovaries, so the ovaries start to burn out. Okay, so in woman reproductive life, you will see there are about 400 of the primordial follicle will grow into the matrix follicles. Okay, so starting from this, you can count. If you don't believe me, you can count. So how many eggs is produced every month? You produce one. Okay, you can calculate that. So hundreds of thousands of ova will be degenerate. About 45 years old, okay, they will be start to cease. Okay, so remember back, what are the things that produce the estrogen and progesterone inside the female's body? Is actually the developing follicles. If let's say that the lady have no longer having the potential ova inside the ovary, because the ovary has been burnt out, there are no more follicles left inside. So what are the things that can produce estrogen and progesterone? There are nothing that can help them to produce estrogen and progesterone, because this progesterone and estrogen are actually being developed or being secreted out by the developing follicles. Okay, so when the levels of the estrogen and progesterone start decreasing, these women are actually facing the menopausal period. Okay. You can take a look at this. When puberty, the level of the estrogen is gradually secreted out, okay, up to 13 to 40 years old during the active reproductive period. So the high level of the estrogen, you can see that once it reaches menopause at the age of 45 to 60, but actually it varies between individuals. Okay, so the level of the estrogens will be reduced abruptly. Okay, so postmenopausal syndrome include the physical, physiological, and also psychological changes. Okay, so the major causes is because of the estrogen, the lack of the estrogen and progesterone. Okay, and then later our body will start to acclimatize with the decrements of the progesterone and also estrogen. But there are symptoms that associate with the menopause, which are the hot flash or hot flashes. We have the vasomotor instability, fatigue, emotional outbursts, depression, anxiety, insomnia, and so for vertigo, palpitation, headache, and so forth. Okay, and long-term effect of the estrogen, lacking of the estrogen, will leading to the osteoporosis and also atherosclerosis. That's why the menopause woman would need a lot of calcium supplements to stimulate the productions, to stimulate the osteoclast activity. Okay, so the treatment is easy because we know that the causes of the menopause is due to lack of the estrogen and also progesterone. Therefore, they need the hormonal replacement. So what are the hormones they're going to use is the estrogen, and some of it might have the combination of estrogen and also progesterone. Okay. So that's it for the, yeah, it's only 15 minutes. That's it for the menopause. Just recap back on the menopause. Why it happened is actually because of the burning of the ovaries. Why? And then why the burning of the ovaries occur? Because there are no more potential ova left inside the ovary, and it will associated with the reduced levels of the estrogen and progesterone. So why the level of progesterone and estrogen reduced in a postmenopausal woman? That because there are no more potential ova or developing follicles that will help them to produce the progesterone and estrogen. So what are the things, how can we treat the woman with having a postmenopausal syndrome? Because they lack of that hormone, we replace them with that hormone. Okay, so as I promised you, oh yeah, before that, I think I'm gonna recap back on the last lecture because I haven't finished a few more slides. I'm going to emphasize the importance because visibility of, where is it? Visibility of lactation. Is it 26? Is it on 26? I don't remember. Yeah, I guess so. Okay. Oops, sorry, cannot open. What's actually happening? Oops. Is it this one? Yes. So many going on. Okay. I just want to show you a few slides that are important that you need to read because I have no time to continue from my previous lecture. Okay, we did discuss this. This one also. Okay, yeah. For the physiology of pregnancy and lactations, I want you to please look at the maternal responses to pregnancy. Okay, this is a previous lecture which I haven't finished because we run out of time. Okay, I want you to look at this. Who knows, it might come out in the exam, who knows, I don't know. Okay, I just a few tips for you. You have to take a look on the physiological changes that occur to the pregnancy, okay, towards the end of the pregnancy. For example, like what is actually happening. So we have a placenta. So placenta will do what? It will give estrogen, progesterone, inhibin, blah blah blah. Okay, what actually happening to the adrenal cortex? So this adrenal cortex will increase the secretions of the aldosterone and also cortisol. All right. And then what about the posterior pituitary? It will increase the secretions of vasopressin. Remember, it's not vasopressin only. It will also produce oxytocin prior to parturition. Okay, prior to parturition. And then we have the parathyroid. It will secrete the parathyroid hormone or parat hormone. And what is actually happening to the kidneys? You need to know this. Okay, as the pregnant women, as towards the parturition process, okay, there will be a changes in the kidneys, changes in the breast, in the blood volume, in the musculoskeletals, in the circulations of the cardiovascular system. The heartbeat also will increase. All right. What about the respirations? Okay, calcium balance, appetite, and so forth. What will occur to the gastrointestinal changes? Okay, to the stomach. Okay, let's take a look at the kidneys. Okay, kidneys in the pregnancy, it will increase the secretions of renin. Okay, so this renin is actually very crucial for the development of the vitamin D, okay, productions of the vitamin D, and also renin will help in the productions of the red blood cells. So why pregnant lady needs a lot of red blood cells? Why they need a lot of HB? It's not a lot of HB. They need an optimal number of the HB because they are actually not helping themselves to breathe and carry the oxygen throughout the circulations. They will also need to give support to the developing baby. So developing baby, by the placenta, they also receive a blood circulations. So that blood circulations, that baby also will need the hemoglobin, will need the oxygens to survive and grow. Okay, their cells will start developing. So meaning that their cells also, the baby cells also will need an oxygen. That's why the kidneys will start increase the renin and also erythropoietin together with the vitamin D. Okay, and another one, in the kidneys, it will start the retentions of the salt and water. Alright, and then it will increase the aldosterone vasopressin and it will increase the renal blood flow. When the renal blood flow is increased, the size of the kidney of the baby also will increase. Alright, that's why the female is urinate a lot. It's not only that, the females, the pregnancy women will urinate a lot is because the developments of the womb will compress the ureter. So the ureter itself cannot expand so much and contains a lot of water, a lot of urine. That's why they urinate quite a lot. Okay, for the breast, it will enlarge due to the estrogen, progesterone, and prolactin. Okay, and then the blood volumes of the pregnancy women also will increase. Okay, if you take a look, the total erythrocyte volume will increase. Why they increase? Because of the erythropoietin. So who produces the erythropoietin is the kidney. So why kidney produce erythropoietin? Because kidney needs to help the developing baby to get lots of oxygen. So who carry the oxygen is the hemoglobin. Okay, and then the plasma volume by the salts and water retentions. Okay, it will increase the clotting factor. That's why in a pregnancy lady, sometimes they might have the varicose vein, which is the vein thrombosis. Behind of their knees, you can see there will be a spindle vein over there. We call it as the varicose vein. What about the musculature? So average, it will increase in size. It will increase in weight around 12 to 5 kg. Alright, and 60% of it is the water. So stretch mark is common. Lower back pain also is common. Okay, sciatica is actually the compressions of the nerve behind their back. That's why a pregnancy lady towards the end, they will have the back pain. Okay. What about the cardiovascular? So their heartbeat will increase as the cardiac output and stroke volume increase. As the blood volume will increase, okay, when the blood volume is increased, the cardiac output and stroke volume will absolutely follow. So the blood volume increase, the cardiac output and stroke volume also will increase. Total peripheral resistance will decrease. Okay, so when it decrease, it will increase the heart rate. Alright, so that's why we see that some of the pregnant lady, they might have a high blood pressure, and their heartbeat also will be a bit fast than non-pregnant one. In the respirations, okay, so they will have an increased intra-abdominal pressure. So meaning that when the baby is getting larger, so it will compress, it will push the intercostal muscle, it will push the diaphragms upward. Thus, due to this manners, it will increase the intra-abdominal pressure. So this increase in the intra-abdominal pressure will cause them to respirate. Their heart rate will increase. Why the heart rate increase? Because they need to catch up the oxygens coming in. So their respirations will getting fast. Some of them might have the hyperventilation. That's why they can see a pregnant lady towards the end, they feel like okay, when they climb the stairs, especially, you will see that they are hyperventilating. And the calcium balance, okay, because they increase in the parathyroid hormone, so they will increase the vitamin D productions, and thus it helps in the development of the baby's bone instead of the mother's itself. Because if let's say the mothers does not have enough calcium to supply for the baby, so their own calcium will be absorbed for the baby, and the appetite enters also will be increased. So in the gastrointestinal, usually during the first trimester, you will see that the pregnant lady will have the morning sickness, they will have a nausea and vomiting. So why this nausea and vomiting occurs is actually, it's not only to tell that pregnant lady that, hey, you are pregnant, but it's actually due to the hormone itself. So progesterone, high level of the progesterone in the early of the pregnancy comparing to the non-pregnant lady, okay, it's actually caused the relaxations of the muscles. So what are the muscles that's been relaxed? The uterine muscles, okay, especially the smooth muscles. So the uterine muscle will start relaxing. Remember, progesterone, we call relaxations of the uterine muscle so that it prepare the bed for the baby to implant later on. Okay, instead of just preparing the uterine muscles, relaxing the uterine muscles, this progesterone also will relax the esophageal also. Okay, it will relax the esophageal sphincter. So when this esophageal sphincter undergo relaxations, that's why they easily to get vomit when something wrong is going on. If let's say that they eat a lot, okay, so they start to feel like vomiting because their sphincter is loose due to the high level of the progesterone. So, and another things, due to the increased intra-abdominal pressure also, it will cause the reflux. Alright. And one more thing, changes in the gastrointestinals. The pregnant lady usually, but not all of it, would associate with the constipation. So they hardly to go to the toilet, okay? Because, as I mentioned, due to the progesterone levels, it will cause relaxations of the smooth muscles. So where else do we have a smooth muscle? We have a smooth muscles not only in the gastroesophageal muscles, we also have the smooth muscle in the uterine, and we also have a smooth muscles that circle our intestine. So that muscles undergo relaxations. So when that muscle undergo relaxation, so they will reduce the bowel motility. Okay, so what do we call the the movement? Oh my god, I forget. Okay, they will slow down the bowel motility, and this slowing process will lead to the constipation. Okay, so that's why you have to take a lot of fibers, okay, and then drink a lot of water and take fruits also. Okay, and the rest is not so much important. So I want you to focus on the changes that happening, okay, physiological changes that occur during pregnancy. So what are they? In the blood volume, in the kidney, what else? In the heart rate, in the respiratory rate, what is happening to the gastrointestinal systems. So what about the hormonal changes, cortisol, parathyroid, and so forth. So I want you to read on this also. So all of this pregnancy sickness is actually happening due to the high concentrations of estrogen and progesterone. Okay, that's all for our class today. So, oh yeah, before that, I want you to fill in your where am I? Oops. Okay. I'm gonna stop sharing this. Before we miss the class, I want you to look at the chat box and then help me to fill in the Google form. Wait, yeah. Okay, look at your chat box. Okay, help me to fill in the Google form before you leave the class. So that's the end of my lecture today on the menopause, on the lactation, okay, and also the last portions on the physiological changes that occur during pregnancy. So there are a few tips for you to, before that,